Hi, Paul. You're on film.
Hi, Doc.
So, Paul, when did you start with us?
I started with breaking through about 6 months ago.
Perfect. What brought you here?
I had a really bad Achilles tendon tear, and they took the tendon from the bottom of my foot and put it in the back of my leg. I had a secondary, well, my leg never really properly recovered from that first injury, and I had no calf muscle on my left leg. With all the compensation I was doing on my right, I pulled my right gastroc muscle, and that's what ended up bringing me into breaking through.
Okay. So, we had a pause. What happened before the pause? What were you able to achieve?
Say that one more time.
So, we paused the treatment
Oh,
for a while. Because what did you achieve before we paused?
yeah, we were going pretty strong for the first 5.5 months, and I achieved the ability to lift up my body weight, or at least a portion of my body weight, much more than I could before. I was able to lift my left heel off the ground with to sustain the weight of my body. Prior to that, I could not lift up my left heel at all. I couldn't do any kind of push off that left foot at all. I seemed to gain a lot of strength in that left hand and that left side, and I got back to where I could jog again, where I'm actually getting faster and able to run better than I was before.
Okay.
Um,
So, Paul had a combination of blood flow restriction training for several months with cupping, instrument assisted soft tissue mobilization, and all of that with exercises. But then you correct me or add if I'm missing stuff. You still have pain. You still had some pain. We could not get the medial gastroc to fire enough to have him do a whole full heel raise on the left one, on standing on a single leg with full weight bearing. Um, what else am I missing?
no, that was about right. And then what the I was gaining strength in that, but I still was not able to do full weight bearing on one leg to lift up my full body weight. I was probably lifting 60 to 80% of my body weight with the one leg. I could do that 5 to 10 times depending on how fatigued my leg was.
Okay.
But that's still much better than I was doing prior to coming to breaking through. I wasn't able to do any prior to that.
So, yeah. Anything else?
The pain, it was different. So I had pain, but it was there was a lot of fatigue pain, and then the pain that I was experiencing was kind of accentuating the parts of my leg that were overcompensating for the lack of muscle in the gastroc muscle.
Now, we started about a week ago, 2 weeks ago,
2 weeks ago.
with the newbie. Like he says, like I tell him, he's cheating on the buffer restriction of the BFR with the newbie now. So what have you found different?
So with the newbie, the pain when I'm going through the treatment, after the treatments is after we finish the treatment, I don't have any pain in my leg at all, and that's the first time in 7 years that I haven't had any pain in that leg. It doesn't last. I mean, it lasts at least 4 to 5 hours, where I have no pain from my ankle all the way up to my hip, and gives me some relief. I do feel stronger, and like those muscles, the muscle that's been atrophied for so long seems to be firing. Like I can feel that there's action going on in that muscle that I wasn't experiencing before.
So before the medial gastroc, you could see everything else firing, all these peroneal muscles, soleus, all the other muscles in the calf, lateral gastroc, they were all firing and getting way bigger, but the medial gastroc was not firing at all. The medial gastroc is the big muscle of your calf and the inside of your leg. That is the medial gastroc, gastrocnemius. And now it seems like it's finally firing. And I like to call that the Frankenstein treatment because we had to electrocute it to bring it to life. So we'll see. We'll see where this takes us now. Pretty excited.
Yep, excited about it. And I thank Breaking Through Physical Therapy for helping me get to this next point.
Thank you.